So while we technically say that a newborn is the first 1 month of life, but in terms of their physiologic makeup, in terms of how they respond to infections, any child below 3 months of age is considered to be a newborn. So if your child is below 3 months of age and they have a fever 38 and above, please go to the hospital because it really could be sepsis.
Welcome back, and thanks for joining us. So the next topic I'm going to talk about is neonatal sepsis and neonatal fever. They sort of go hand in hand sometimes. So neonatal sepsis, what is neonatal sepsis? It is infection that gets into the baby's bloodstream in the neonatal period, which is the first 4 weeks of life, okay? It is a very dangerous condition, okay? One of the earliest signs would be your baby sort of starts being a bit quiet, a bit lethargic, not crying so well, poor feeding. Now, temperature-wise, it can be one of two things. It can be either a fever, so anything 38 degrees centigrade and above, we term a fever, or it could actually be hypothermia, which is where the temperature goes the other way. In newborns, it can be either or, okay? So it could be high temperature or it could be low temperature, okay? So that could signify a sepsis as well. If that's the case, please, you need to seek medical attention immediately. Now, if for any reason your baby has a fever, say fever of 38 degree, 38.5, not 39, or anything above 38, 38 and above, please do not accept oral antibiotics. Please, I am begging you. That baby needs IV antibiotics until all the investigations are done. And then the doctor can decide whether to continue with the IVs or stop the IVs, depending on baby's condition after 48 hours or depending on what the results of the investigations have shown. Do not accept oral antibiotics in a neonate that has a fever, okay? Because if it is the beginning of sepsis, oral antibiotics are not going to work. Oral antibiotics in neonates, the absorption is not reliable at all, okay? So we only tend to use oral antibiotics if it's like just a mild, maybe a skin infection or something, and the baby is systemically well. So insist on IV antibiotics initially, okay? Now, if sepsis is, the other point I want to make is, if your baby has early sepsis, do not sit at home waiting to see, oh, let me see if the baby gets worse. Please go to hospital immediately. It's better for you to go to hospital and it's nothing serious than for you to sit at home and it's something serious like sepsis. Why do I say this? Sepsis has 3 phases. There's sepsis can go into something called septic shock. Okay? If sepsis is not treated on time, it goes into septic shock. Now, there are 3 phases of this shock. There's the compensated, where the baby's body compensates, fine. It might just be maybe a higher than normal heart rate, cool peripheries, things like that. But baby's managing the sepsis fine. And if you don't do anything, it progresses to something called decompensated, which you can still get in there and sort things out. The third phase, which you do not want to get to, is called irreversible shock. And as the name implies, it's irreversible. No matter what the doctor does, no matter what the hospital does, it's irreversible, and the mortality rate is very, very high, okay? So basically what I'm saying is, if your baby has a fever, is unwell in any way, any of these early symptoms, please seek medical attention. And if there's a fever or temperature is low, insist on IV antibiotics initially, until they do their investigations and tests to check it's not pneumonia, meningitis, urinary tract infection, or, it could be anything really. So that's the safest thing to do, okay? So that's all I have to say about neonatal sepsis and fever.
Well, you said it, and everywhere in the world, globally, the prognosis and the outcomes for neonatal sepsis are very poor, even in the best settings. And what I'd say is that for all intents and purposes, a newborn is considered anybody less than 3 months for when it comes to sepsis. So while we technically say that a newborn is the first 1 month of life, but in terms of their physiologic makeup, in terms of how they respond to infections, any child below 3 months of age is considered to be a newborn. So if your child is below 3 months of age and they have a fever 38 and above, please go to the hospital because it really could be sepsis. And sepsis in a 2-month-old is as serious as sepsis in a 1-month-old.
Yes, and thank you for bringing that up and talking about this, because I think it's very important. Now, when you talk about neonates, and then you talk about the neonatal period, it's the first 4 weeks of life, the first 30 days, 28 to 30 days,
28 days.
first 28 days, right? And then we even have criteria for fevers in the urgent care in the US. It's like when a child comes in from newborn to 28 days, newborn 28 days to 60 days. After 60 days, the treatment is different for everybody. So when you have a fever for a baby that is in the first 28 days, that's the neonatal period. Nigeria has one of the worst neonatal mortality rates in the whole world. And that's because our babies are not getting the attention that they need, especially when they get sick. So if your baby has a fever, your baby is not feeding well, a baby that is healthy will eat, they'll pee, they'll poop.
They'll cry.
Your baby, they'll
Cry.
cry, they'll be very active.
Yeah.
They're always in a state of flexion. Their hands are
Yeah.
like this. Or when a baby's like this and is not moving, not even crying,
Limp.
don't stay home and hope for the baby to get better.
Yeah.
Please
Yeah.
go to the nearest teaching hospital.
General hospital.
Go to the nearest general hospital, the nearest hospital where you know that you will see your baby will be in a pediatric unit. And if there's no general hospital, make sure you go to a well-known or anywhere where there's a pediatrician. Don't go to a GP to take care of your baby because the baby, what Dr. Zainab and what Dr. Rena has said is extremely important. You want to make sure that baby gets IV fluids and IV antibiotics. Because once you start a baby on IV antibiotic, it can take another 3 to 5 days for the cultures to come back. So if I see a baby now with a fever and I'm checking, you always want to you check the blood, the urine, and the lumbar puncture. You do a spinal tap for that baby. If your baby doesn't get those three, especially when we don't have a source, then we're not doing a thorough evaluation. And your baby, while waiting for the results of those tests, will need to be on IV antibiotics and IV antibiotics at high doses depending on what we're suspicious of. So very important, please make sure you take your babies to the hospital if they have a fever, if they're not eating well, if they look sick, if you're worried, go to the nearest hospital where there's a pediatrician. Ask for a pediatrician and make sure your baby gets the best care possible.
And so just to add, I'm going to actually give a story. It's a sad story, but I'm going to give a story so it makes it more real, So in my facility, not too long ago, we had a baby came to us. I think the baby was about 2 weeks of age. So I think baby was about 3 weeks of age, sorry. At 2 weeks of age, baby spiked temperatures at home up to 39, okay? So what the parents did, they called the obstetrician that did the cesarean, who now, without seeing the baby, prescribed oral antibiotics over the phone. And of course, Nigeria, you can go over the counter, buy these things. The parents went and they bought the antibiotics, oral, and kept the baby at home another 6 days. So baby came about 3 weeks of age in irreversible shock. And you can imagine what the outcome was. The baby was in a really, really bad way. And it was sad because if that baby had come on the first day of fever, that baby most likely would be alive today and would be well. But it was left too long. They waited one week on oral antibiotics, which was doing nothing. It just got worse and worse. The parents themselves realized this baby is getting worse, and they now came to hospital 1 week later. It was too late. Baby was in shock. Okay, so please, just to make it more real for you, very important, please. All right.
At that point in time, you do everything you can. It's already
everything was done. Everything was done.
Put the baby on life support.
Oh yeah.
Everything.
Oh yeah. That's why it's called irreversible. And like my colleague Dr. Rena has said, anywhere in the world you have irreversible shock.
There's nothing.
They're not magicians. There's no magic that they're going to do. So please, it's best to get in there early. Okay.
Early diagnosis, prompt treatment, very important. All right.
Okay. Thank you very much.
Thank you.
All right. Thank you.